My name is Waseema. I'm one of the respiratory speech and language therapists in the Manchester Airways service. So I've been asked to speak to you today about upper airway disorders, specifically something that we call inducible laryngeal obstruction, that we diagnose, assess and treat within our service. So my plan today is to kind of give you a bit of an overview of what my role is within the service, what we do as MDT, the assessments that we provide and the intervention that we give as well. So Manchester Airways service is one of maybe 4 or 5 tertiary services within the country that provides assessment and treatment for, as I said, specifically upper airways disorders. As speech and language therapists, we kind of sit within that team. So why would somebody refer to our service? So we receive referrals from across the country, and normally the question that they're asking us is this ILO? Now, as we move forward with the presentation, I will explain what that is. A lot of the time, these referrals, the patients that they're referring into us, they've got symptoms of choking attacks, shortness of breath, stridor, which is noisy breathing, aphonia, which is where they either lose their voice or have difficulties speaking, dysphagia, so swallowing difficulties, or ognophobia, where they feel that they are struggling to kind of get food or drink down. So this can have a huge impact on people's lives. They'll end up making regular A&E visits, and they'll be placed on medications like inhalers, steroids, which are unnecessary for the treatment of this condition. And there's a lot of fear and panic around this condition as well. So as I said, the speech and language therapist, I sit within the Airways MDT, and you can see my team there. So we're a group of doctors, speech therapists, physiotherapists, psychologists, and we have a specialist nurse as well. So once that referral comes in and that individual is triaged into our service, we'll assess them. We'll provide them with what we call a one-stop assessment and laryngoscopy. So they'd come in for a full day, where we'd see them in the morning, and we'd then assess them between us, and then in the afternoon we'd complete a laryngoscopy to see if we can make a diagnosis. So what is ILO? So you can see here, you've got your lungs, you've got your breathing pipe here, and then on top you've got your larynx, or your voice box. So what we're trying to do is diagnose and treat ILO. So what is ILO? ILO is a term that we use to describe a narrowing of your vocal cords. Okay, so your vocal cords will narrow, and as a result you will struggle to breathe in. Okay, and this can be very debilitating, and it can cause a range of symptoms for patients, which can be mild, moderate to severe, and when it's severe it can cause panic attacks and loss of voice, as I said earlier, and lots of noisy breathing as well. So what do people with ILO report? So they'll say things like, my inhalers don't really work, I feel like I'm gasping for air, I feel like my throat is shutting off, I feel like I'm being strangled, or I feel like I'm breathing through a straw or a slit or cling film. So these are quite common reports from patients that we get. So what does your breathing normally look like? So here you've got an image of a lovely larynx. So when we put the camera down, the laryngoscopy, this is the image that we'd be able to visualize and see. So I'll explain what you've got here. So down here is your breathing pipe, your trachea, that's your opening, the air entry for your airway. These white bands here are your vocal folds, and their primary use is for voicing. So when we talk, when we produce sound, these white bands come together, and that's what allows us to to produce voice. Okay, and this leaf-shaped structure here is your epiglottis, and when we swallow, this flap closes over to stop any food or drink dropping down into your airway. So as you can see here, this area is extremely important. Okay, there's four primary functions, one being for breathing, one being for swallowing, and one being for voicing. Okay, now this is what we would expect to see. As you breathe in, everything stays nice and open, and as you breathe out, typically everything would stay nice and open like this. Now, when you've got ILO, inducible laryngeal obstruction, here you can see what happens. So this is what things would look like normally, nice and open. You can easily breathe in and out. When you've got ILO, you can see that this is very reduced. The space is significantly reduced, and there's very little space there for the individual to get that air in, and that's what causes the panic and the noisy breathing as well. Okay, so this is not a life-threatening condition. However, it can be very scary for individuals. As you can imagine, if you're struggling to breathe and your breathing is noisy, people around you can kind of panic as well. So yeah, it's really important that when we see this, we reassure the patients as well that it's not life-threatening and there are ways that they can manage this. So I'm going to show you a video now of what happens when somebody is having an ILO attack, as we call it, or an episode. So you can see that narrowing as the video goes along. There isn't any sound to this. However, if you keep watching, you will see the vocal cords starting to narrow and come together. Okay, play that now. So what is the speech therapy role once we've diagnosed? So we complete the laryngoscopies and support the doctors in the diagnosis of the condition. Once it's been diagnosed, we reassure the patients and we'll provide them with a block of therapy. So the main treatment for inducible laryngeal obstruction is with speech and language therapy, so they don't require any medications for this. A lot of the time, people that present with this condition will also have asthma, and the symptoms are very similar. They can mimic each other. So a lot of the time when people have been presenting to A&E or gone to the doctors, they'll be given lots of inhalers to try and use. But in actual fact, they're not going to do anything. They'll aggravate their symptoms more because it's their upper airway that's actually the problem. not their lungs. So we'll educate them, reassure them, and we'll provide them with breathing exercises to allow them to manage their throat better, and open everything up easily. So again, I'll show you a video, and there is sound on this, of my colleague who's performing a laryngoscopy. So she's a speech and language therapist, and she's doing the laryngoscopy, and she'll provide the patient with education around what to do. So this individual has got inducible laryngeal obstruction, and you'll see that everything will become very tight and constricted, and with specific breathing exercises that she'll talk him through, he'll be able to open up his larynx again. So again, when we're doing the camera tests, we're looking for other things as well. So sometimes people will have reflux, and that can drive and irritate your throat and exacerbate your symptoms and make your ILO worse as well. And we're looking for kind of mucus around your throat as well, or postnasal drips. If you've got stuff dripping down from the back of your nose, again, that can irritate your throat, and that can lead to you being more symptomatic as well. So I'll show you that.
So just focus on your breathing. So gentle breath in, gentle breath out. In and out. And in and out. Perfect. Okay. So when you're ready, I want you to do a sniff in and then say E. Keep going, keep going, keep going, keep going, keep going, keep going, and take a deep breath in and out. Perfect. That's absolutely fine. Okay, and then count from 1 to 5 for me.
1, 2, 3, 4, 5.
Perfect. Okay, and I just want you to do a throat clear. Okay. And can you try a cough for me, but of course just hold it back. That's it, perfect. That's fine, that's fine. Okay, so if you open your eyes for me, okay, and then face the screen, and I'll move with you.
Oh, hey.
Okay.
Oh, it's fine.
That's bloody awful.
We love it here. So,
does that all look good, by the way?
That looks absolutely fine. I'll explain to you what I'm looking at, okay? So, I'm going to hold this steady. You keep steady as well. So, you can see... Actually, I might ask you to point to bits to the screen if you don't mind.
Me
so, yeah, point to that hole down there. So, that's your airway.
Yeah.
Okay, so that's what you're breathing in and out of. You've got 2 white bands.
Oh, at the back.
That's it. Those are your vocal cords.
Oh, right.
So when you say E, they'll come together and vibrate. Try that.
E.
That's it. Can you see they're vibrating now? Perfect. And then when you take a breath in, they open up.
Yeah.
When you hold your breath, they'll close.
Oh, right.
Okay. Now when you cough, do a little cough. They'll come together forcefully to expel anything from your airway. So when you do that over and over and over again, that hole closes.
Yeah.
That's when you pass out.
Yeah.
So the idea is you make that opening as wide as possible at any given moment.
Mm-hmm.
And the way you do that is with a little sniff in. That's it. So really nice and wide. And then 2 puffs out through rounded lips. So like you're blowing out 2 candles. Yeah. Perfect.
Oh, that's perfect.
So it's a sniff, puff, puff.
A short sniffing.
Short sniff. Perfect. And that entrance to your airway completely opens up.
So this can have an impact on your voice as well. It can cause your voice to become quite croaky and hoarse. Because of the constriction, it causes a lot of muscle tension. So that's something else that we'd work on in speech therapy. We provide exercises to reduce that muscle tension intrinsically and extrinsically, alongside providing laryngeal care, so teaching you how to look after your throat and reduce that irritation that might be there from coughing, from the ILO episodes, from the muscle tension, from drivers like reflux and nasal drip. So it's very individualistic. Based on what we see on the laryngoscopy, we'll plan therapy for you, and based on what your concerns are as well. So yeah, in terms of the therapy, we'll base that on the assessment and information that we have. A lot of the time, you know, patients have to buy into what we're offering, because once they're diagnosed with this, they think they're going to be provided with a medication or an inhaler that's going to allow them to manage this, but actually there isn't anything like that available. It's management with behavioural therapy, and we normally offer them a block of 4 to 6 sessions. Once they've had the therapy, we'll bring them back in for another camera test, just to reassure them that there's nothing sinister in their throat, make sure that their techniques, they're using them correctly and they work for them, and make sure that they're confident to continue using those exercises. So we'd normally discharge after that, and then patients would just continue to manage those symptoms with the therapy that we've provided, and then we can always bring them back for kind of a refresher session if they need as well. So that's the end of my presentation. Thanks for listening.